There are moments in every person's life when they face intense adversity. They're crucibles that forge who they become as individuals and as leaders. Now more than ever, we need leaders who are called to a higher standard, focused on leaving it better than they found it, and paying it forward to the next generations. Now, let's join Fire Chief Randy Brugman as he speaks with leaders from all walks of life, as he explores and learns from their personal journeys and the crucibles that have forged them into better leaders and better people.
Welcome to another episode of the Leadership Crucible podcast. Today, my guest is Rudy Jackson. Rudy serves as the Chief Nurse Executive of UW, University of Wisconsin Health. He's an experienced healthcare leader with a broad knowledge in large integrated academic health systems and a very successful history of improving nursing outcomes and engagement, as well as hospital operational performance. Rudy previously served as a nursing officer for the Buffalo General Hospital and Gates Vascular Institute in Buffalo, New York, the largest healthcare system in Western New York. He has previously served in leadership roles at the University Hospital in San Antonio, Texas, along with over 20 years of Army experience. Rudy earned his Bachelor of Science degree in nursing from the University of the Incarnate Word in San Antonio, Texas, his master's degree in healthcare administration from Webster University in St. Louis, Missouri, and his doctoral degree of nursing practice from Yale, New Haven, Connecticut. He is also certified in executive nursing practice from the Association of Nurse Leaders. Rudy, welcome to the Leadership Crucible podcast. It's just a pleasure to have you on the show, and it's great to see you again.
Yeah, thank you so much for having me. Yeah. Great to be here.
So I know you've had some difficult challenges as you were growing up. We had talked previously about this, and how did that help to shape who you became? And where did it lead you, from your childhood to where you're at today?
Yeah, I think everybody has a story, right? I mean, everybody's story is unique to them, and what you do with that story is ultimately what defines how you end up being as an adult, as a leader, as a human being. I think for myself, my upbringing was pretty humble. I grew up in a very small town in the farthest southernmost border of Texas, so we were about 10 minutes from the Mexican border. Single parent, 2 kids. My mother didn't have an education, so we struggled for years and years and years. Didn't live in homes. We bounced around from apartment to apartment as we could afford them. My mother would oftentimes work 4 or 5 jobs to try to provide for my sister and I. She would oftentimes say that she refused government assistance because as long as she was able to work and provide for her kids, then that was going to be her priority. And I think a lot of that instills sort of my work ethic and sort of the way I was raised to work in the future. There were some periods of our time where we were living in a vehicle. We didn't have a home. And again, I think that just grounds you as an individual. No matter how successful you become, in a lot of situations, you're 1 paycheck away from being uninsured. You talk to the financial advisors and you're supposed to have X number of dollars in your savings account. But the reality is, for the vast majority of Americans, that's just not the reality. And at the drop of a hat, something can change. And we saw a lot of that over the last several years.
Yeah. Yeah, well, your mother was really a driving force for you, wasn't she?
Very much so. My mother and I have a really interesting relationship. We, like a lot of kids and a lot of parents, we've had our up and downs up throughout the years. When I was very young, my mother said to me, "You are too old for me to discipline and too young for me to mourn." And I, to this day, remember those words. And I was enrolled in the U.S. Army at that point. So I was signed up at 16, going through basic training the summer of my junior year of high school. And again, I think a lot of that was really what helped navigate, what the course of my future was going to look like. Even in the Army, I was 16, 17 years old. I wanted to be an infantry, person and wanted to go out there and save the world. And the Army, when I took my ASVAB test, I scored pretty well on it. And so they said, you really could become an engineer or get into medicine. And I became a medic in the Army at that point and really got the best of both worlds. I was able to be put into a position of service, but was attached to a combat infantry unit and was able to really go out there and do the adrenaline stuff that a young man thinks that they can do. And that really drove my passion for not only healthcare, but really service of people in everything I've done. And so really since the age of 16 until I'll be 50 years old in about 2 weeks, my entire professional career has been about service.
Yeah. So, serving in the military, I think you had 20 years in the service, right? So,
yes.
So what, I mean, did you go right in and start as a medic, or did you start out as, after you got through basic, is that the track you took, or how did that work?
Yeah, I didn't have any ROTC experience or anything like that. The military was not something that was on my radar early on. Growing up down in South Texas, being 10 minutes from the Mexican border, just getting across the border, at 15 years old, you can start drinking and party at the clubs. And that was really sort of why my mother said, I need some help. I need some direction. I need some discipline. And going through boot camp at Fort McClellan, Alabama, which is now closed I guess at the time I had just turned 17, writing letters back to my mother saying, I'm so sorry, I'll never do this again. I promise I'll behave. These people are yelling at me. It really changed the outcome of my life, without a doubt. I've had great military leaders, and I've had not so great military leaders. I've been able to learn, that being a leader is not so much about rank. It's not about titles, and it's not about a position so much as it is about encouraging, supporting, building the relationships with the people around you to really engage them in the mission. And I've been able to take a lot of those skills and incorporate them into my civilian life.
Yeah.
Right before, and I'll share one quick story. Right before I deployed to Afghanistan, I was pulled out of the Army Nurse Corps. So I started in the Army in 1990 as a medic. I was an E1. So for those that don't know the military, you have no rank on your chest or on your collars. There's nothing there. Then you move up to an E2, and you get what we call mosquito wings, or these little, the triangle, if you will. So I started off as an E1 as a medic. In the late 90s, I joined the Army. Got into nursing school, graduated nursing school, and then commissioned in the Army as a lieutenant and stayed attached to the Army Nurse Corps. In 2008, I got pulled out of the Army Nurse Corps and was transitioned over to civil affairs. And so I moved from the Army Nurse Corps to a civil affairs battalion based out of Fort Dix, New Jersey, and did some training at Fort Bragg. And the training I learned at that time was really around communicating with insurgents, talking about how to get to a common ground with the indigenous population within Afghanistan, how to navigate complex topics, and how to navigate complex conversations. So it was like reading the book Crucial Conversations times 1,000. I got some great training from the Special Forces folks that would oftentimes joke with me that this isn't the Army Nurse Corps. Here I've got to work much harder. And so they told me to take off the stethoscope and my Crocs and put on a 60-pound rucksack and go on a road march. But the training really helped support my individual growth, and particularly my growth as a leader. And I've been able to incorporate a lot of that in my civilian practice.
Yeah, that had to be fascinating to learn how to navigate, because when you're dealing with different cultures and different perspectives, as you were in Afghanistan, that had to be just really challenging, but I would imagine somewhat invigorating to actually be able to sit down and have some of those conversations.
It was incredibly invigorating to be able to do things like have the first democratic election in the area that we lived in, called Nuristan, Afghanistan, to establish a rural EMS service, to be able to build a girls' school and wells for folks. Some of our troops visited areas that had never been visited by American troops before and could only get there by aircraft. And so incredibly rewarding time that we spent out there. The training and the education, I mean, there are so many things that were nuanced, like when you're talking through an interpreter, you don't look at the interpreter, you look at the person you're speaking to. Again, now when I'm in the civilian sector and I'm talking to somebody with a different dialect or different language, I don't look at the interpreter, I look at the patient, or I look at the individual I'm speaking to. So again, it's just all of those little skills that you learned along the way that really can help formulate who you are as an individual is pretty powerful.
Yeah. Well, you've had a lot of different jobs, as most of us have, but you've been successful in every one of them. So, what would you attribute your success to? I mean, what's that foundation that has led you to where you are today?
Yeah, I'm glad you asked that question. I sat down about 4 or 5 years ago with an individual and, said to this person, tell me about your goals. Tell me about your future. Where do you see yourself down the road? And his response surprised me a bit, partly because you hear that this is what you are supposed to say to folks, but also because I've never actually said this myself. And so what he said to me was, I want your job in 5 years. And I thought, okay, so how are you going to do that? How are you going to get there? Because there were a lot of steps that, he needed to go through in order to get that position. And it really made me think a lot about my own career trajectory and how did I, get to where I am? How was I so fortunate to go from the roles that I've had over the course of my career into this position? And what I said to him was, you need to seek success in what you're doing today. Don't focus on the journey. Don't focus on what you can achieve. Don't focus on a salary or an office or a title. Focus on the success of what you're doing today, and the rest will come. And that's really all I've ever done is I don't know what the next step for me is. I don't know what the next position for me is going to be. I just want to be as successful as I possibly can be in the role that I'm in today. I want to support my staff. I want to encourage the staff to exceed. I want to offer them the best that I can possibly give of myself. And then if there's something else for me in the future, that'll happen. Yeah. But if not, I'm completely satisfied with what I've done and where I've been.
I think that's a really good perspective because oftentimes we're always chasing the next promotion and things, or the next job, the next step up. And frankly, I think your perspective is right on. Just if you love what you're doing, do that the best, take care of your people, and something good will happen. I mean, something good is going to happen to you down the road. You'll get another knock on the door or a call and say, hey, we've got an idea or an opportunity for you.
Yeah. I was driving down the road the other day listening to NPR. They were talking about some politicians, and I thought the very same thing. If politicians had the tendency to truly want to do the best they can, and I know a lot of them do, and not focus on that next Senate seat or that next appointment with whatever it may be, then we could probably get a lot more done. But everybody's got their ambition and their reasons, whatever that may be. I really truly believe, regardless of what you're doing, regardless of what role you're in, whether you're, cleaning an office room like my mother used to do, or delivering food, do the best that you possibly can, and opportunities will present themselves.
Yeah, no, totally agree. My mother kind of said the same thing. She said, never judge a person by what they do. Judge them by the actions that they undertake. And whether they're serving you food at the local restaurant or, cleaning up at the hospital or operating on you, it's all about the character that they bring each and every day. And
could not agree more.
You and your staff were really on the front lines of this whole pandemic issue for 2 years. Very, very challenging for you and your folks. So can you tell us a little bit about what you learned from going through that experience? And I think you're still probably going through some aspects of that even today.
Yeah, we've got about 3,600 frontline nurses. I mean, we've got a little over 4,000, but truly frontline nurses taking care of patients every day. We've got about 3,600. I will tell you, I have been overwhelmingly impressed with their commitment to patient care, to supporting one another, to making sure that we have the staff that we need to take care of the people that we have in front of us. As administrators, I think what I learned over the course of the pandemic is that we can do a better job with communicating and with transparency. That's what I've heard from nurses around the country. Administrators have done the best they possibly can with the limitations we had on supply chain and all of these different issues that came up. But at the end of the day, it was always about, the patients and getting our patients taken care of. I take a little bit of a different approach philosophically to that, in that, my focus is not entirely on the patient. It is more so focused on the staff. And I believe that if our staff are taken care of and our staff are supported, then our staff will take care of the patients. They'll do what they signed up for. We are surrounded by people that want to care and want to serve others. But I learned some really, really positive things over the course of the last several years around nursing, around physicians, respiratory therapists, all of the healthcare provider teams that are out there, day in, day out, taking care of things that we know. And what we learned is that taking care of things that we don't know.
Yeah.
But I've also seen some negatives, and by negatives I mean some of the problems that have risen as a result of the stress that has been placed on our frontline staff. We have seen an exodus of our workforce, people who are tired. I'm sure everybody remembers the ER doc that committed suicide due to the stress of the pandemic and the inability to save everybody. That has been something consistent. I was talking to a group of nurses really in the height of everything, and I said to them, when you think about post-traumatic stress disorder and you think about the effects that it has had on American soldiers, on American Marines, on Navy personnel, all of us, Air Force personnel, it's always tied back to the combat zone. It's tied back to the war zone and some event that happened out there. What I saw was a lot of the same symptoms, and I shouldn't say saw. What I have seen is a lot of the same symptoms and a lot of the same nuances within our workforce that I saw with soldiers that were coming back with post-traumatic stress disorder. I think the difference between the two is that, in the military, I've got equipment that I know is designed to protect me. I know where the enemy is. I know that the person on my right and the person on my left is here to protect me, and that they have my six. With COVID, we didn't know in the beginning if touching this doorknob was going to end my life, or if I was going to take something home, or if the person next to me is going to be the one that gets me sick. Is this mask enough? Do I need more? There were so many unanswered questions. There were so many concerns that the entire hospital workforce was hypervigilant, just like an armed person, an armed services person would be in overseas, hypervigilant. And then we get all of this information that's coming in from the CDC, and absolutely no disrespect to them, they're putting out information as quickly as they can, but there was so much of it that it became almost a little bit of noise, and the staff didn't know, well, yesterday when I left, I was told to wear this. Today I'm told I don't need that. Which is it? And it was traumatic, and it's been traumatic. I have, nurses that I've spoken to that have said that they've had to strip down into their undergarments in their garages and would yell at their children and their spouses to stay away from them until they bathed. That's a trauma that not only they feel, but also their families are feeling. I've spoken to nurses that have said that during the height of the pandemic, they lived in a hotel in downtown to avoid having to go home and run the risk of getting their family sick. So, to some extent, that's a deployment in and of itself. You may not be in a war zone, but you're certainly not in your home, sleeping in your bed with your loved ones around you. You're living in a hotel. So I've seen some great things, and I've seen some things that we as a country need to do more to support. The well-being of our workforce is a real thing that keeps many of us up at night. The burnout of our workforce, the sustainability of the workforce, being able to maintain the empathy that we had pre-COVID. There were a lot of nurses that I spoke to that really struggled with, the political views that COVID took around vaccination versus non-vaccination, and having to give 100% of your attention and care to somebody who didn't believe in COVID yet has it. And then watching a person in another room succumb to their disease, to this illness, and they did everything they were supposed to do. And having no rhyme or reason to that has weighed on many healthcare providers' ability to empathize, ability to make sense of what we do, to trust the science. There's been a lot of challenges that people have had that they've had to navigate. And so I think we as an industry, we as a country have a lot of work to do around really reinstilling that faith in our healthcare system, around the science, letting the experts dictate our practices, not politicians, and moving past all of that occurred.
Yeah, and I hope we can get there because there was just there's a litany of examples of where the politic, overrode science, and that's never a good thing. I think we have to believe in the folks that know what they're doing and follow their advice. And it was very, very difficult. And it put your folks in a really difficult situation because it was changing every day.
Yeah, particularly right now, we're talking about, a lot of the leaders in this area are talking about the tridemic.
Yeah.
We've got influenza running pretty aggressively down in the south, moving north. So it's coming our way. We've got RSV all over the country, not only affecting children, but affecting adults. Mm-hmm. And we still have COVID.
Yeah.
So it is a challenge, and it is something that we all need to be vigilant about.
Yeah, totally agree. So, coming out of the pandemic, what other changes have you seen in your workforce as a result?
Workforce shortages nationally have become a problem. There was a recent article published by an organization called Nursing Solutions Incorporated, or NSI. They publish an annual report regarding healthcare workforce every March. This last report, for the first time, showed nursing turnover rate exceed all other hospital employee work groups. So basically, registered nurses were turning over at a higher rate than our dietary staff, our environmental services staff, than any other staff within the healthcare system, at a rate of about 27%. So just imagine that number for a moment, that some hospitals are turning over their nurses at a quarter of their entire workforce per month. That is staggering when you think about our ability to have that longevity, that bench strength, that experience in our teams that we need. Nursing is a lifelong learning profession, just like being a paramedic, just like being a firefighter. We don't graduate from our academies or our schools, wash our hands and say, now we're experts and we're done. There's always new science, there's always new technology coming forward. But if you start to lose that history and lose that experience, you're bound to make some of those mistakes that we've already learned from again in the future. And so one of the fears that many of us have is really around sustainability of our workforce, making sure that our workforce is feeling appreciated, that they are receiving the appropriate mentorship, healthcare, mental care support that they need, that we're compensating appropriate with our market. All of those things are just at the utmost level of importance for us today, because we have to sustain our workforce. I said to somebody recently, and I certainly don't mean any, disrespect for other specialties, but nursing can do a lot. We can do a significant amount of the work that many other services already do within the healthcare system. And so within our scope of practice, there is a lot of other things that we can do. No other group can do what nursing does. And I don't share that to say that, nursing is special. We're different. We're unique in that way. But we need everybody here. We need the teams here. If I lose all of our respiratory therapists, nurses can draw ABGs and give treatments and manage ventilators, but that's just another task that we're putting on the nurse that keeps that nurse from doing something else. And if I'm losing respiratory therapists and nursing at the same time, then what is that going to do for the care that our patients are receiving? And that's the struggle that I think many healthcare leaders around the country are navigating right now.
Well, and the 27% that you're losing, is that on a national basis? That's how many are leaving every month and going to do something else?
Yeah, that's an annual turnover rate for the hospitals around the nation. So this last report had 323, I believe, hospitals that were surveyed around the country. Every state was represented. And that was the average that they came up with. Now, I will say that at our hospital, we are very, very fortunate. We are very, very fortunate. I apologize for that. We have our turnover rate is less than half of that. And our vacancy rate is really, really low. We've got great, support around our nurses. We offer our nurses an opportunity to be part of solutions through a shared governance model. So, I was just talking to a nurse earlier today, and he said to me, nothing should happen to me without me. And by that, he means that nursing has to be, at least in our workforce, at the forefront of every decision. I'll take nursing completely out of it and say that as a leader, we have got to bring our teams to the table to have discussions around what are the issues and how do we solve them collectively. I oftentimes joke that I get into a room with a bunch of people and I am oftentimes not the smartest person in the room. And I am okay with that because I shouldn't have all the answers. I should endorse the solutions that they come up with. I should help support, process, and remove barriers for them so that we can work together to make the best environment that we can. And I think as a result of that, the fruits of that labor has been a low turnover rate, a low vacancy rate, and a more engaged workforce.
Yeah. Well, I'm just thinking about that number, and I don't care what industry or profession you're in. If you have a 20%, 25%, 27% turnover of your staff every year, I don't know how you would run your business.
Yeah, I mean, I don't think it doesn't matter, right? I mean, imagine Ford Motor Company losing 20%, 27% of their staff that makes a Ford F-150.
Yeah.
Are you going to produce as many vehicles as you would before? So you're absolutely right. It doesn't matter what industry. Those are incredibly concerning numbers.
Yeah, really are. So how are you building your bench strength then for the future?
I think nursing needs to think outside the box. I think everybody needs to think outside of the box. I happen to be very fortunate to live in an environment where our unemployment rate is 1% in the city. And I think the gig economy has really done a lot to employ people in areas that they typically would not have gone into. Uber, Dashdor, all of these different places that I work very, very hard to my wife's demise to keep employed. But I think for us and in this industry, it's been a bit of a challenge and we need to be creative. And we've developed some pretty unique opportunities out here for us to empower individuals in lower socioeconomic areas, people of color that typically would not have the opportunities to get into healthcare and to start the journey into developing your own profession, and allowing us to do that. And so one of the things that we did, and I was having a conversation with the CEO of our organization, and I said, here's an idea that we have that we've sort of come up with, how we would like to increase our workforce. And he said, well, that's really a great idea. Nothing I've ever seen or heard of. How are you going to fund all of that? And I said, well, that's why I'm talking to you. We laughed about it. And shortly after, he received a phone call from a philanthropic donor that said, I'm just really interested in helping support our healthcare systems. I know it's been a rough couple of years. What are your thoughts? What are your challenges? And he said, we've got this nursing leadership team that has this idea around supporting, again, people of color, areas of socioeconomic support, and increasing our numbers of registered nurses, but also other healthcare professionals within the industry. And here's our plan. And so he shared with her the plan and immediately generated some interest and received a very, very nice donation that we are really going to focus every dollar on improving, enhancing, and supporting our workforce. We have a program that we are calling Project Strong. The R and the N will be in capital letters, probably a different color. Mm-hmm. And that's really about taking individuals from our community, bringing them into our workforce through an apprenticeship program, allowing them to be certified nursing assistants or medical assistants, and then supporting their path to becoming registered nurses. That means that we would pay for your tuition. You will receive a full-time salary, full-time benefits, but you're only going to work part-time, and we're going to buy some of your time back so that you can focus on your education. We're going to bring tutors, so these will be graduate-prepared nurses that could help support the education and position these individuals to be as successful as possible. We're creating a student center of excellence. So, I think about even my own journey, growing up very, very poor and some of the challenges I had to struggle. Yep. You're trying to raise a family while you're working full-time and having to go to school full-time, and then life gets in the way. What support could we offer along the way? So we're looking at case management support, being able to connect individuals to resources in the community that could help with things like childcare and transportation. So it's not going to be just focused on the education, but it's going to be focused on the life of the individual and how we support them. There's a lot of people that I've spoken to around the country from some really, really highly esteemed organizations that are very interested to see the outcome of this program, because nobody's really doing this. This isn't about taking philanthropic dollars and putting a big name in lights on a new building. It's about investing in the future of healthcare. And if we don't do something today, we're going to be in a very, very, very bad spot in the next several years. The most recent study that I saw published by the advisory board estimates that as many as 500,000 nurses will be short in the next 3 years in the country. 500,000 nurses, 500,000 nurses. And what's further compounding this is that we're turning away roughly 80,000, almost 90,000 nurses from nursing schools because we don't have educators to educate them. So the nursing schools are struggling. The government tried to solve this problem and offered scholarships for nurses to get their master's in education. But nurses make more money at the hospital than they do in an academic setting. And so a nurse with a master's degree will make 6 figures as an educator in a hospital, make 5 figures as an educator. So where are they going to stay? And so I think with programs like this, we're able to hire the individuals to manage the clinical practice, keep them here in the building, making the salaries that they're making here, having some extended dual appointment back to the university, and then not negatively impacting our operational margin, but using and leveraging philanthropic dollars to help support these individuals and the resources that we're going to need. We are incredibly excited about what this could look like for us down the road, and hopefully in the next 6 months we'll be submitting some articles for publication, because the beauty of this is that it's completely translatable to other communities around the country. This is not unique to my area. There are very, very wealthy individuals all over the country that that could do this, and more importantly, are going to need to do this, because at some point in our lives, no matter how healthy we are, we'll always need healthcare. And that's just the reality. And we'll always need nurses.
Well, it's a great pathway that you've created, to build your bench, but also I think to reach out to the underserved in the community and give them an opportunity to create a better life for themselves. And I think that's just tremendously rewarding on both sides. And so I applaud your effort and the UW's effort for doing so.
Well, I appreciate that. And it's certainly, I'll tell you, it's certainly not me. I've got an amazing team of nurse leaders, an amazing group of nurses that are really helping us navigate all of this work, and an incredibly supportive leadership team here that really has empowered us to do this. But I just got to say, I think about my own individual journey. Young Hispanic kid in South Texas. If somebody had told me one day that I would be where I'm at today, not only I would have laughed, but so would everyone else around me, because that just was not in the cards for us. That's just not what we saw as an option and as a possible future for us. And so we've got to enlighten these folks and support them as much as we can to say that the world is so much bigger than what they've come to expect.
Yeah. And sometimes it's just a matter of seeing where you could go and not limiting your vision, right?
Yeah, one of the other comments that I made, and I wasn't going to share it here, but you sort of brought it up, was sometimes people need a little bit of a kick in the rear end when they start getting down on themselves. And I think about a gentleman I used to work with as a technician in an emergency department down in San Antonio, Texas, when I complained to him about, working 2 full-time jobs, going to school full-time, burning both ends of the candle. I'm exhausted. Why don't I just quit? My life would be so much easier. And having somebody say, you're 2 years away from your life being completely different. Giving up now is the worst thing you could possibly even think of doing. And just hearing things like that motivation just gives you a kick and allows you to achieve what you needed to achieve. And what I tell folks is the year before I became a nurse, I worked 2 full-time jobs, went to school full-time, slept about 4.5 hours a day. My first year as a registered nurse, I made twice as much money as I did in the previous year, and I worked in the entire year 0.0067 hours of overtime, and that was purely by accident. So sometimes that kick is what you need.
Yeah. So, what other advice would you give to our next generation in respect to really making a difference in their life journey?
Yeah, I think there are several things I would say. One of them I already shared, and that is seek success in what you're doing today. Let's focus on the work we have in front of us, and lead as much as we possibly can, because it doesn't matter if you're a formal leader or an informal leader. We are all leaders to some capacity, and be that leader that you want to see. I also think that particularly with our younger generation, they're asking a lot more questions than my generation did, than some of my previous generations did. They're asking a lot of really good questions. The one thing I would ask is that we stop for a moment and seek to understand. Everything is done for a reason. Some of them are really good reasons, some of them not so good reasons, but we should always seek to understand the reasons behind what we do and why we do it before we try to make any changes or decisions. And I just think that gives us an opportunity to pause and understand the history that came along with some of that. And then finally, I would say we need to take care of ourselves. We talk about people's health, we talk about their well-being. I had a nurse that was precepting me when I first became an RN, and I was working really, really hard. I had a lot of things that I needed to take care of with these 5 or 6 patients that I had. It's about 1:30, and she says to me, "Have you gone to have lunch?" And I said, "No, but I've got too much to do." And she said, "Stop. You need to eat. You need to take care of yourself, because if you're not well, you can't take care of your patients. These will be here when you get back.
Yeah.
Nothing is so critical you need to do today." And I really took that to heart, because I think at the end of the day, when we should all work hard and we should all do what we need to do. But at the end of the day, when our life comes to an end, my tombstone is not going to say, "Here was a really good nurse and a really good nurse leader." It's going to say, "Here was a husband, here was a father, here's a grandfather." It's those things that are more important. So take care of yourselves as you're looking at these leadership journeys and where you're headed.
Yeah. So my final question today is, what takeaways would you like to leave today to help someone maybe become a better person, better leader in the future as they travel their journey?
I would say educate yourself. And that doesn't necessarily mean that you have to go back to school and become a PhD in sciences of any sort, or even in leadership. But I think when I say educate yourself, I mean, look around at the leaders that are around you. Look around at the people that are around you. I was at the supermarket the other day, and I watched a manager talk to an employee with the utmost respect and with a tremendous amount of courtesy. And I walked away from that moment thinking to myself, that's how a leader should talk to a person, to encourage them, to support them, and say, "Hey, don't worry about this. It's okay. Nothing is wrong. We're going to fix this, and we're going to work on showing you how to get it so it's done the way that we want it done." Leave people with that integrity. That's important. But educate yourself on what you see, on how leaders act. Think about the leader that you want to become. Think about the relationships that you can develop, and then pause for a moment and just reflect on every single day, because things change quickly. I had a boss that told me once, she was 3 levels above me, and I said, "You're always so nice to me and the others." And she said to me, and I think she was only halfway joking, but she said to me, "I'm always nice to people below me on the organizational structure, because you never know when they're going to be above you." And I just thought that was a really important lesson, because journeys are what they are, and nobody knows what somebody else's journey is.
Yeah.
So treat everybody with dignity, treat everybody with respect, because down the road you might find yourself at the other end of that situation, and you want to make sure that people remember how you led and how you behaved.
Yeah, we often overlook our untitled leaders throughout our organization, don't we?
We do.
They have tremendous value and insight, and so often because of our positions, we don't think to ask and engage them.
Absolutely. One of my favorite things to do with our new nurses is to share with them our organizational structure, and share with them that ours is upside down,
Mm-hmm.
and I am at the absolute bottom of the total board.
Yep.
I've got 4,000 bosses that are constantly telling me what to do, and that's okay. That's why I'm here. But
Yeah.
again, it just enforces the fact that I'm not sitting in a tower making decisions with a heavy hand. It is more so me removing barriers, supporting and elevating who I can.
Yeah, opening doors and
Yeah.
and helping people.
That's exactly what it's all about: is opening the doors and then getting out of the way.
Yeah, get out of the way. Yeah, good leadership is always surrounding yourself with people that are smarter than you are.
Absolutely,
Yeah.
absolutely. Which is why I like to say I am very rarely the sharpest tool in the toolbox.
Yeah, me too. Well, Rudy, thanks for being on the Leadership Crucible podcast today. It's an honor to have you, and Appreciate the friendship and wish you the best as you move forward in this coming year.
Thank you so much, Randy. I really appreciate the time here. Look forward to getting together with you again in the future.
Thank you.
Thanks for listening to the Leadership Crucible podcast. If you have a story of adversity you'd like to share, we'd love to hear it. Join us next time as we continue to explore how to live lives of success and significance.